Thank you very much for having me here. And what I'm going to try and do is sort of frame the current sort of dilemma about toxic substances and products based on about 20 years of research writing, work in the private sector, public sector. What we're finding here is there's so much going on at this present moment, as Jennifer was noting, from international policy to national policy to state policy to markets moving on chemicals and products. And one question is, why now? And I think one of the big changes that we've seen over the last 25 years, when our current chemicals regulations were written in the early 1970s, the Toxic Substances Control Act, the types of problems we were worried about were rivers catching on fire, very high exposures in the workplace, chronic diseases such as cancer. And as we've learned more and more about chemicals and actually addressed some of the more egregious types of exposures, we've learned that smaller levels of exposures from multiple dispersed products do cause exposures during often critical windows of vulnerability, so early development in the womb, early years of development, and that those are much more difficult to control. So if you're talking about chemicals, for example, in the foam cushion you're sitting on, flame retardants called polybrominated diphenyl ethers, we've done studies to show that they are showing up pretty much in every woman's breast milk in North America. There's not an easy way to control that exposure. It has that flame retardant has a very important function, yet we're finding that little or small amounts of chemicals are being dispersed throughout our environment. They're in our homes, they're in our bodies. Every American child is born with about 200 plus chemicals that have been identified in their cord blood. The Silent Spring Institute, a nonprofit science think tank here in Massachusetts, has done studies of houses on Cape Cod and identified numerous, dozens of chemicals, including chemicals that were banned 30 years ago in the houses of women, chemicals that are potential breast carcinogens. That's what Silent Spring is doing, is looking at the links between breast cancer and the environment on Cape Cod, which has an elevated incidence of breast cancer. So we've moved from point source exposures from a smaller number of manufacturing facilities to very dispersed exposures from products that are non-point, difficult to control, and often have only a single point source of exposure, which is wastewater treatment. And our wastewater treatment systems were not designed to address these types of chemicals. So, for example, triclosan, an antimicrobial that is used in hand soaps, ends up in wastewater treatment plants and can disrupt secondary treatment processes which rely on bacteria to break down contaminants. So this is one of our big problems right now. Also, increasing evidence. I'm a scientist, and we're finding increasing evidence of the links between certain chemicals and potential health effects. While we can't demonstrate that these chemicals are causing diseases such as cancer or learning and behavioral disabilities or the increase in incidence in asthma, we're increasingly understanding that they could play a role. We can't prove it. For most chemicals, we can't demonstrate with certainty that there is a link between chemical exposure and human disease. But as we learn more from cellular studies, from toxicological studies, we're gaining much more knowledge about the potential for those impacts. At the same time, we're seeing a lot more understanding of how chemical design can affect chemical toxicity. We're learning that certain chemical structures do increase toxicity, do increase the potential for exposure, and conversely, chemical design, the way we design chemicals, can actually reduce that toxicity. So we can actually design chemicals to be much less toxic in nature. This is the field of green chemistry, which is the design of chemicals that are inherently less toxic. So as this knowledge about dispersed exposures to chemicals and chemical toxicity increases, so have actions at the federal, state, international level. As Jennifer mentioned, the REACH regulation affects every company in the world that exports a product to Europe. And that means Massachusetts companies, where about 40% of our exports. Massachusetts is the second largest exporter of products to Europe. A particular example is the European regulation on restrictions on hazardous substances in electronics and electrical products, I believe our second biggest export product from Massachusetts. If Massachusetts companies do not comply with those restrictions on certain metals and flame retardants in electronic products, they lose their market. So As one electronics manufacturer indicated to us in some interviews about switching out of lead as a component of solders, he said, for years, a decade, we were toying with lead alternatives, and we didn't make any progress until Europe banned it. And then we actually had to do it overnight, and it happened. So often government policy brings people above or beyond that sort of threshold of action, right? We've been toying with it. We didn't have the complete incentive to do it. Now we have to do it. So as the European Union has been moving forward during the previous administration, and I was on an EPA advisory committee on chemicals, there was basically no acknowledgement of any problems of the 1976 Toxic Substances Control Act. EPA basically said there's no problem. Change administration and some action in Congress, there has been a new acknowledgement that this 30-year-old law, which was designed for a different set of problems, is outdated and needs to be modernized. There are certainly some very interesting aspects of that law, which I studied during my dissertation. There are some challenges of that law, and I'll get to them in a minute. But the failure of federal action on chemicals really led to the states, which have traditionally been the innovators in chemicals policy, to start moving forward. There are 10 states in the country right now that have been moving quite rapidly over the last 5 to 6 years, introducing a range of chemicals regulations, from chemical bans to broader chemical prioritization processes identifying chemicals of concern, to labeling provisions, to procurement actions of what governments can purchase and can't purchase. For example, the state of New York just issued a restriction on 83 chemicals in state purchasing. A lot of these are summarized in a handout that was given to you. A colleague of mine, actually an NEU law grad, developed a database that has over 900 pieces, actually over 1,000 now, pieces of enacted and proposed state chemicals regulation over the last 10 years. So the states have been, there's been a flurry of state action. A recent report by a federal coalition of advocates identified, I think, 19 states introducing chemicals legislation in this session. One of those is the state of California, which, if California has been toying with a California state regulation on alternatives to toxic chemicals that we've been involved in, if that regulation passes, in the end, that will affect the whole global marketplace. So you have governments moving forward at the state level. And then at the corporate level, we see markets moving much faster than any kind of government action. And that's a very interesting change here. I think a good case study of how fast markets move is the case study of bisphenol A, which is a component, a building block of polycarbonate plastics used in those Nalgene bottles. I've never seen in 20 years something move as quickly as BPA and polycarbonate. Overnight, you saw a whole market for drinking bottles made out of a material switch into another material, Eastman's Triton copolyester. Now, what's interesting about that, when the marketplace does it, is it moves, but there was very little assessment of whether this alternative material is actually safer. A big problem. And actually, some of the research I've been doing seems to indicate that there could be some issues with it. So when the market moves all by itself, there's a potential as well for problems when government doesn't guide that marketplace. Another example that's out there is Walmart right now is requiring that every chemical product manufacturer into Walmart disclose into a database all intentionally added ingredients that are then, it's a database organized by a for-profit software firm in New York that then screens all those chemicals against certain hazard criteria, and the Walmart purchaser gets a red, yellow, green indicator of whether they should purchase it or not. Walmart will change the markets faster than any government can ever change markets. If Walmart says you can't use this chemical in our products, overnight the marketplace will change. And we're seeing many other retailers do this. Staples in December issued a list of 28 chemicals that they are requesting that their largest suppliers remove from all their products. And these are fairly major chemicals and products. And we're talking with major suppliers like HP and others. We are organizing a network of companies called the Green Chemistry and Commerce Council, which is a network of about 70 companies across sectors, from SC Johnson to Nike to HP to Staples, you name it. And they're all wanting to move towards safer chemicals and products because they realize at the front end of who is going to take the consumer pressure for change. It's not going to be the chemical company or distributor in the background who no one knows their name. It's going to be the Walmarts, it's going to be the Nikes, it's going to be the Levi's who are going to get that pressure. And they're realizing that they don't necessarily need a particular chemical. They need the functionality that chemical provides, and if they can get it at the same price, it works well, and it's safer, that's better for them. So I think in the future, coming years, we're going to see a lot more action happening at the market level. We're actually putting together a meeting of retailers in May to talk about how retailers are shaping the marketplace and the types of skills they need to be able to do that. Because a Walmart, I can tell you, having worked with Walmart, is they don't have a clue about toxicology, and they're relying on outside sources to help them shape what their toxicological criteria will be. So in the end, we're seeing all of these changes happening, and at the same time, they're responding to a series of failures in public policy that are happening and that are forcing the change in regulation. And those range from the lack of information on many chemicals in commerce. So for the vast majority of chemicals out there in the marketplace, we know very little about them. Our laws that are on the books today have basically assumed that chemicals are safe until demonstrated dangerous. So our 1976 Toxic Substances Control Act grandfathered all chemicals on the market when it came into effect in 1976. So that's about 95% by volume of chemicals on the market today are assumed safe until EPA, on a chemical by chemical basis, demonstrates with sufficient scientific certainty that there is a risk and that the benefits of regulation exceed the costs, and that they are choosing the least burdensome regulation to actually meet a risk reduction goal. So does anyone want to take a guess at how many chemicals EPA has regulated under the statute?
6.
5. 5 in 30 years. And the one they went to after 10,000 pages and 10 years of record was asbestos. And the Fifth Circuit Court of Appeals turned over their regulation saying that EPA had not met their least burdensome options requirement. So EPA gave up. They basically gave up on trying to use their regulatory abilities to regulate chemicals, understanding that they're never going to have the sufficient evidence, and that they're diverting resources from other places to be able to do that. So there's a whole set. We're actually finishing an analysis of TSCA, looking at the history and understanding that it is a very complex nexus of procedural, resource, and political and statutory burdens that have kept EPA from being successful in this law. So there's that slow, inefficient process. So every chemical has to be assessed with a certain level of certainty, using, creating data often, because that data doesn't exist. And that's costly. EPA spends millions of dollars doing single chemical risk assessments, dollars that could be spent assisting industry, for example, in finding safer chemicals and products. And there's absolutely no way the agency could ever undertake the thousands of risk assessments that are necessary to analyze the entire chemical universe. There are some very interesting bright lights here. So there's that lack of stimulus for safer alternatives. If I can use something like lead, which is cheap and works amazingly well, and no one's telling me I can't, why would I bring a safer material to market? Because it's cheaper for me to continue using what works well, and it's unregulated. And there are some cases of that. I'll give another case of these risk-risk trade-offs that in Massachusetts we use a chemical called perchloroethylene in dry cleaning and other industrial processes. Another solvent used in furniture finishing or furniture refinishing is methylene chloride, another solvent. I better get to the act, right? So what often happens is we put in regulations on a single chemical like perchloroethylene, and what we get is folks moving to the next drop-in substitute that works, that's cheap. In this case, it was what was the perc alternative? It was and bromopropane, and propyl bromide, which turns out it was unregulated, but it turns out also to be a strong neurotoxicant, and now it appears that it's more carcinogenic than PERC. So when the government doesn't shape that marketplace, we run into problems. So let me move towards Safer Alternatives Bill. So we have two options here, right? We can react to every chemical problem as it comes up using the same old sort of costly risk assessment, risk management methodology we've had on the books for 30 years, or we could establish a proactive policy that helps transition companies towards safer alternatives and prioritizes that chemical universe. And as Jennifer said, we have a history of that with the Massachusetts Toxics Use Reduction Act, which really has helped industry and focuses on two things: prioritizing that chemical universe, getting companies to understand how and why they're using chemicals, undertaking a process of looking at alternatives, and then providing technical support to industry to implement those alternatives. One of the limits there is that TURA only focuses on production processes and not really on products, so it doesn't address products coming from out of state. So often our companies are even at a competitive disadvantage if for example, we're regulating our companies under the Toxics Use Reduction Program, and someone making a product that may be less safe is sending it into the state. And also, how do we use that existing infrastructure that's been incredibly useful? So it's the Safer Alternatives Bill, which has been introduced in the Massachusetts legislature over the last 8 years, has built on this approach that we have in Massachusetts of prioritizing the chemical universe, understanding how chemicals are used, looking at alternatives, and providing technical support. As Nick Ashford at MIT often says, to get innovation, you need willingness and capacity. So law provides that willingness and that structure. Technical support provides that capacity to innovate. The bill, as introduced, prioritizes the chemical universe because we're dealing with thousands of chemicals. Where do we start? So by identifying the chemicals of highest concern and chemicals of lower concern, you can identify the places where you can make the most impact with your government resources. And also it provides signals to the manufacturers of the types of chemicals that should be avoided, the ones we should start looking at. It focuses on replacing chemicals with safer alternatives. So rather than bans, and the word ban has been bantered about a lot in the Safer Alternatives Bill, the word ban is not in that because many of us believe that bans are not a useful strategy for most chemicals, because often when you ban a chemical, you end up with the next cheapest thing that works that is a drop-in substitute. And we understand that changing chemistries and production processes is a production process change. So it isn't always as easy as you find another chemical that works, and when you do that, it often leads to risk trade-offs. So it's really about an efficient transition approach rather than ban the chemical, see what happens next. And then this careful time transition to safer alternatives is the key component here. Again, Massachusetts companies are primarily product manufacturers. They're not chemical manufacturers. When they look for a particular chemical, they don't need the chemical. They need the functionality of that chemical or some other means to achieve that functionality through design change or whatnot. So if they can achieve that functionality in a cost-effective way without major changes to their production process, then there's benefit to them. There's a win-win situation here. And we've worked with a lot of firms that are struggling with how do we get good information from our supply chains? How do we prioritize? How do we think about those safer alternatives? So the benefit of doing this here in Massachusetts, and the Massachusetts approach, is we have incredibly good resources here through the Office of Technical Assistance and the State Office of Environmental and Energy Affairs, and we have the Toxics Use Reduction Institute at UMass Lowell, which has done an amazing job working with small, medium-sized manufacturers, for example, to help them find alternatives to chlorinated solvents, trichloroethylene, the Woburn chemical, civil action chemical. We've reduced it in Massachusetts by about 95% by seeking safer alternatives and providing technical support to companies to overcome barriers to change. So we understand that focusing on alternatives assessment is a very different approach for government agencies and often for industry, and that will require a lot of tough transitions and focus change in thinking about how do we do this differently. It's not impossible. It just requires new ways of doing things. For example, when the state passed its mercury ban law, or mercury products law a few years ago, it took DEP to figure out, well, how do we actually institute a bill, for example, that regulates products from outside the state? How do we think about that? And that doesn't mean you shouldn't do it. It just means that you've got to develop the types of resources and types of systems to be able to do it. And then lastly, I think one of the things that's built into this law is flexibility. Understanding that certain companies have certain critical uses of chemicals that may be of concern, and they may not be able to get out of them immediately. They may need research and development support. So built into the bill is funding for R&D to help design and develop those safer alternatives. So, so let me just end by saying the marketplace is going this way, and the sort of holding back and waiting for regulation to happen is not a very innovative or very useful approach, given that the marketplace is moving towards safer alternatives anyway. So there is a key role for government to help support that transition to safer alternatives, to identify what are the chemicals of higher and lower concern, to identify what are the alternatives that seem to be functional, cost-effective, and safer, and then to help develop the plans to transition industry towards safer materials. So I'll stop there.